Hello, this is Dr. Joanne Manson, Professor of Medicine at Harvard Medical School and Brigham and Women's Hospital. I'd like to talk with you about a recent report on prior preterm birth and small for gestational age birth in relation to maternal blood pressure during the menopause transition. This is a recent report in the journal Menopause from the SWAN cohort, the study of women's health across the nation. Now, we've known for a long time that certain pregnancy-related complications such as preeclampsia, other hypertensive disorders of pregnancy, gestational diabetes are associated with elevations in blood pressure as well as heightened cardiovascular risk in the mother. But less has been known about the relationship between a prior preterm birth or small for gestational age birth and blood pressure trajectories. Now, this was looked at in SWAN among 1,008 women who were of diverse races and ethnicities, and they had repeated blood pressures measured. The first was measured before the final menstrual period at an average age of 46, then again around the time of menopause, then again up to 10 years past menopause. And women who had a history of preterm birth, which was a birth prior to 37 weeks, or small for gestational age birth, which was a birth weight of the offspring less than 10th percentile. Each of these was reported by about 10% of the women, were compared to women who had only full term or appropriate for gestational age births. And what they found was for women who had a history of small for gestational age births, there were consistently higher blood pressures at each of these time points. On average, for the systolic blood pressure was about 4 to 7 millimeters mercury higher, which was substantial. Also, diastolic blood pressures were elevated. And for women who had a history of preterm birth, there was a significant elevation of the systolic blood pressure during the postmenopausal that visit, during the postmenopause. Now, these models were adjusted for other risk factors. They were adjusted for sociodemographic factors, body mass index, lifestyle factors, multiple medical factors, as well as prior pregnancy complications such as preeclampsia or gestational diabetes. And these risk elevations persisted. However, the investigators did not see that there was a clear difference in the rate of change in the blood pressure over time. So there seemed to be similar trajectories of increase. However, the women who had these birth conditions did tend to start out with higher blood pressures or have higher blood pressures at these various time points. So what do we learn from this study? Well, again, it appears that a pregnancy-related condition is associated with a cardiovascular risk factor, and it suggests that particularly for women who have a small for gestational age birth, that checking blood pressure frequently, also checking during the premenopausal years, for example, once this increased risk is identified from the small for gestational age birth, having regular and frequent blood pressure checks would be indicated. And also this could help to lower the risk of developing hypertension or lowering future cardiovascular risk if different preventive or therapeutic modalities were instituted. So once again, we're seeing that a pregnancy related complication or a reproductive factor is suggestive of a woman's future cardiovascular health, provides a window into her future vascular health, and provides guidance in terms of her clinical management. Thank you so much for your attention. This is Joanne Manson.